So our goal in the ViPOR regimen was to try to move therapy away from conventional chemotherapy toward targeted therapy. Now, most targeted therapies in lymphomas are given as single agents or they're given as doublets, and now more people are looking at triplets. But because these agents frequently do not put patients into remissions, patients are given them on a chronic basis such that they will often receive them for months or years as long as they seem to control tumor. Our goal, though, was to take a number of targeted agents, in our case 4, and to hit the various survival pathways that are commonly found among some of the more common lymphoid tumors, and to give them in cycles, the way we give chemotherapy in cycles, and to only give it for a total of 6 cycles. So we do not give any chronic therapy with it. It's simply 6 cycles, just like you would give R-CHOP, and it's given every 3 weeks. And the idea here is, can we obtain very durable, long-term remissions using a very different strategy, using targeted therapy than what we are conventionally using with chemotherapy. Right now, it is still a phase 1B type study, so we have just finished doing the safety on it, and I can tell you that it turns out to be extremely safe and well tolerated, and the patients we were using it in had received a median of 3 regimens, and 3/4 of them were refractory to their last therapy, a group that infrequently responds to more chemotherapy or even in some cases targeted therapy. An overall response rate in this early study has been pushing around 80%. And so it's looking very promising. We're getting a reasonable number of complete remissions. They are durable so far, but follow-up is very short. So we're at the very start, I think, of a new era of trying to possibly replace chemotherapy using multi-agent targeted therapy.